The decision to get your child vaccinated against COVID-19 is deeply personal and may weigh heavily on parents and guardians. If you've been hesitant to get your child vaccinated, you've probably asked yourself questions such as, what are the risks? If my child has already gotten COVID-19, do they even need a vaccine? And can the COVID-19 vaccine protect against new variants? All of these questions and concerns are valid, and you deserve honest answers, which is why we've asked Champions for Vaccine Equity, Dr. Sheila Davis and Dr. Hector Frisby, to join us here today. The first question is for Dr. Davis, who is a doctor dedicated to reducing health disparities and currently serves as the director of CDPHE's Office of Health Equity. From your perspective, why do you think children should get the COVID-19 vaccine?
Thank you for that question. The risks of COVID-19 illness outweigh any potential side effects from the vaccine. And we know that the COVID-19 vaccine is effective at preventing severe illness, hospitalizations, and death. Further, the COVID-19 vaccine protects the entire family, including children too young to receive the vaccine, as it reduces the likelihood of transmission among family members. Also, while most children have mild to moderate symptoms from COVID-19, some can develop complications of COVID, including long COVID. And then finally, this vaccine has undergone the most robust monitoring of any vaccine in the history of vaccines.
Thank you so much. Now for the second question, I want to ask Dr. Frisby, who is a family medicine doctor. So what are some things you'd want a parent to know when they're considering the COVID vaccine for their kids?
Besides the point that Dr. Davis just pointed, they are very important. It's important for the parents to know that the doses of the vaccines are smaller, the concentration is small, and it's in a specific vaccine for kids. It's not the same like as an adults. The second one is the side effects of the vaccines. When they receive the vaccines are very mild, and they're just like any other vaccine going away in 24, 36 hours, and the protection is for a long time. The third one is they need to consider that this vaccine is free. It's for free. Nobody needs to pay for that. The other factor is they don't need an ID and any way of identification to go and have the vaccine in the places that's offered, that there are numerous places. The next one is they have the chance to have paid time off. They can skip work if the kids, they have some adverse side effects. And this is very important for the parents that they are working. The other questions that the people is having is if they can have the other vaccines, the regular vaccine schedule that they need to have, they can have in the very same day. The COVID vaccine, the first and the second dose, they can have in the very same day.
Thank you so much. And then finally, Dr. Davis and Dr. Frisby, I'm wondering if you have any final thoughts that you would want to share with parents and caregivers, especially those of color?
Well, I understand the historic mistrust that communities of color have with the medical system, with public health. But I just want to underscore that people of color have participated in these clinical trials, and it is these vaccines are efficacious with people of color.
Yeah, in addition, the people they need to consider, this is not a new vaccine. The technology of the vaccine has been for a while, and we are considering this one as a public health issue. We are staying aside of all the politics and all this discussion that they are having in another arena, which is not a matter of the public health. We are concerned about the people, and we are just here to give information for the people to make the best decision for their kids and just to help them from the public health perspective.
Thank you, Dr. Davis and Dr. Frisby, for your time and for sharing this information on COVID-19 vaccines. If this got you thinking about vaccinating your child, we encourage you to visit covid19.colorado.gov/vaccine-finder to find a provider or clinic. You can also learn more by attending our virtual learning session on COVID-19 vaccines on June 9th, where we will have even more information for you and will provide an opportunity for you to ask even more questions. You can click the link below to register for this event. We look forward to seeing you there, and thank you so much for listening.